Tell me what you want, tell me what you need. 'Cause if your head is full of dreams, I got it right here waiting for you. I got it right here waiting for you. Doesn't matter what you dream, I got it right here waiting for you.
Hello, and thank you for tuning in to this segment of We Are Living Healthy. There are pros and cons to many things, and medication is no exception. They were created to help us feel better, but let's face it, when used in the wrong way, it could have catastrophic effects. That's why I'm so excited about our guest today, because here to help prevent this, we have Prevention Supervisor Dennis Southers, and we also have Educator II, Vivian Alibah. Please welcome them to the show.
Hello.
Hi,
Good
how
morning.
are you? Yeah.
Good.
All right, both of you have very important roles with the city. And could you please, first, Dennis, could you tell us a little bit about what you do?
Okay, I am actually the new prevention supervisor. So we provide a lot of different trainings to the community. All of the trainings are free. Many times we come to you to provide those trainings. All you have to do is call us for more information on that. And we really provide education. We save some lives with some of the suicide interventions, even the drug education, because we provide a lot of drug education to the community as well.
Yes. And Vivian, you're an educator too.
Yes. And what we do, just to add to what Dennis said, is we do a lot of education and awareness when it comes to mental health. So, as we all know, we are all, especially with the pandemic, we're all struggling with mental health. So what we provide is tools, and tidbits on how to recognize signs and symptoms if someone is experiencing mental health challenges, and how to support the person or help the person till the professionals arrive or till the crisis, is averted. So we do that. We also provide ACEs, which is Adverse Childhood Experiences, and that's a training that we offer to community members, and that's to just help them understand that the experiences that you experience or you go through as a child can sometimes have an adverse effect on your health, as an adult. So we do that as well. I also do help with HIV testing and training. With the safe substance abuse education program at the Renaissance Academy. And we're always in the community, providing awareness, training, resources to anyone that's interested. I always say that knowledge is power. So if you're interested in any information, please reach out to us.
Yes, thank you. That sounds like a lot of wonderful services. And I know that when people are in crises, or when people do have depression, or when people are suicidal, a lot of times we turn to the medicine cabinet to feel better. And so, Dennis, I know that you know a lot about the proper storage and what can go wrong and why it's important, and what actually happens in a household when you have not the proper way that you're storing your medications.
Right. Well, Vivian and I both work with a program with the schools, and we know that teenagers, the number one way that teenagers get medication is from their friends and their family. And so we just want to encourage parents or anyone who has teenagers to make sure that they lock up their prescriptions, or if they're not using the prescriptions, that they dispose of them properly. And we provide medication to storage and disposal kits. So one is pre-made and the other one just tells you what you can do yourself. If you have a Ziploc bag, some dirt or kitty litter, how you can actually just get rid of the medications yourself without having to go to the police precinct, although that's an option as well. But many people have so many different types of drugs at their house. And I can tell you that young kids are looking, not all young kids, but many young kids that we see are looking for drugs in people's houses. And they take the drugs, they do what's called a farm party or a skittle party, where everybody brings their drugs, they mix them in a pot, and you take them to see what's going to happen. I'm sure Vivian can add some more to that too.
Yes, and Vivian, if you could, when it comes down to the disposal kits, why is it that we can't just throw them away? Why do we need a disposal kit?
Well, number one, if we just throw them, in the trash can, guess what? It ends up in the dumpster. And then we have people that go seeking for meds. So you have someone out there dumpster diving, and they find a pill bottle that has Vicodin or Oxycodone in it. Guess what? You just made their day. So we want to make sure we prevent that. We also want to make sure that the environment is safe. When we flush our meds down the toilet or down the sink, it goes straight into our water system. And our water system isn't adequate enough to process and filter out all the chemicals. So that is why the best way to dispose of it is what Dennis had mentioned, to use the medication disposal kit. Or you can just put your meds in coffee grounds, right, in a Ziploc bag, and then you toss it in the trash can. So we want to make sure that we dispose of it properly. And we also want to make sure that when you're disposing of your meds, you take the label off your pill bottles. There are so many times that you find empty pill bottles and it has people's personal information on it. And God forbid, if you have, refills on prescription meds, guess what? The person who got it could easily call and go pick it up. So disposal of medication the proper way is essential for our health, for the environment, and for the community as whole.
Thank you so much, Vivian. I wouldn't have even thought to remove the label. So thank you for that. And Dennis, you mentioned something earlier. I have a teenager, so I'm very aware that sometimes as parents, we are completely oblivious as to what they are capable of. We're not even thinking about it. We're thinking, this is my medicine. It's in my cabinet. My kid's not going to touch it. What are some of the things that parents can just kind of be blindsided to that you see happening every day?
Well, one thing is cold and cough medicine, because it contains dextromorphan, and it's an ingredient where if you take enough of the Robitussin or the NyQuil, you can get a hallucinogenic trip. So many teenagers are drinking bottles of Robitussin, or they're getting the pills, the chlorocidin tablets from the stores. And again, you can take as much as, people take those to get a hallucinogenic trip as well. So we just want to make sure they lock up the drugs. Some kids actually do their research and they'll go online. And there was a student one time that he did his homework and he found out he could take 16 chlorocidin tablets and have a great trip. Well, what happened is that he took the 16 tablets, had a great trip, but he gave his girlfriend 8 of those tablets and she ended up at the emergency room at the hospital. Drugs work differently on different people, and anytime you're experimenting with them, there are dangers of the person overdosing and possibly not even recovering. I think the Department of Health released information about opioid deaths, and 2021 has been the highest year for opioid deaths of any other year so far. And part of that may be COVID-19 related, but there's a lot of hurting people out there. So we want to find other ways to get them help.
Right. No, thank you. That's so important, just to kind of see medication is not just medication, but it is a drug in a sense.
Right. Mm-hmm.
Right. And Vivian, I know that there is something called, I don't want to say it wrong because you're the one who's the specialist on this. We have Revive.
Yes. So Revive is a class that we provide to community members, and that's also to help prevent, the opioid crisis. And Revive really is educating and training the public on how to use the naloxone. So that, for instance, if you find a friend or a family member that has overdosed on opioids, you use it on them to revive them, and then you're able to call for 911 or professional help to come. So when you use the naloxone, you still want to call, because that's not the end of the treatment. They have to come, and then they have to take the person to the hospital to provide, comprehensive treatment to the person.
Okay. I believe that's a wonderful resource. And Dennis, is there any other services that you guys offer to the public that are beneficial in any of these situations?
Well, I would just add to what Vivian said about the Revive class, because we offer the class in partnership with the Office of Consumer and Family Affairs. The good thing about that class is open to anyone, and it's an in-person class, but we also partner with the emergency medical staff and the police officers, and their stories about the big thing that you hear now is the fentanyl. And they had a police officer that he had gotten a little bit of fentanyl on the collar or on his shirt, so he just wiped it off. But fentanyl is so strong and so dangerous that it immediately is absorbed in your skin, and he had to be rushed to the emergency room. So it's an extremely dangerous drug. In the Revive classes, the one thing they offer And we do partner with Chesapeake Integrated Behavioral Health, and they offer the naloxone spray, which can bring the person back to life if they overdose from an opioid. So, and again, there's no cost for this. Right now, we're going with Revive, with the Revive classes, and Chesapeake. Chesapeake offers them for free after the class. And soon we're going to have it offered at the Virginia Beach class too. It's coming, but I don't think we're quite there yet.
Yes, I think it's so important that we have these services and that people know it's not just for people who are necessarily drug users, but it happens to everyday people in certain situations. Vivian, if people want to contact you guys to know about the classes, to know about all of your services, what is the best way for them to reach you?
So the best number to call is 385, right? 0838, 385-0838. And we have our wonderful office assistant who would go ahead and schedule and put you on the next class that we have. The classes are free, they're very educational, and I would encourage every community member to take advantage of it.
Yes. Well, thank you both so much. You've blessed us with so much information. Thank you for joining us today.
Thank you.
Well, that's it for this segment of We Are Living Healthy. Thank you to everyone who tuned in. Be sure to subscribe to the show and follow us on Facebook and Instagram at We Are Living Healthy. And if you have a health story that you would like to share, don't hesitate to reach out to us so we can get you here. Thanks again for tuning in. That's it for We Are Living Healthy.